Therapeutic drugs can heal or harm depending on dose and patient factors. In this first part, we'll survey commonly used medications with narrow safety margins and the mechanisms by which they become toxic. Therapeutic drugs of toxicological importance. Many everyday drugs carry the risk of severe overdose. Paracetamol, safe at recommended doses, becomes a liver poison when its metabolic pathways shift toward a reactive intermediate, N-acetyl P benzoquinone imine, which depletes glutathione and leads to centrilobular necrosis. Non-steroidal anti-inflammatory drugs inhibit cyclooxygenase enzymes, but in excess, they impair renal blood flow, precipitate acute tubular necrosis, and disrupt platelet function, raising bleeding risk. Opioids, from morphine to fentanyl, act on mu receptors to suppress respiratory drive. Overdose causes hypoxia, hypercapnia, and potentially fatal coma. Lithium, used in mood disorders, has a narrow therapeutic window. Levels barely above therapeutic can trigger tremor, seizures, renal impairment, and cardiac arrhythmias. Antiarrhythmics like digoxin inhibit the sodium potassium ATPase, but in toxicity they provoke bradycardia, heart block, and gastrointestinal symptoms. Each of these agents illustrates how saturation of normal pathways or accumulation of active metabolites can tip treatment into toxicosis. Therapeutic drugs of toxicological importance to managing these poisonings requires prompt recognition and targeted intervention. Paracetamol overdose calls for N-acetylcysteine, which replenishes glutathione and intercepts the reactive metabolite before irreversible damage. NSAID toxicity is treated with supportive care, hydration, monitoring of renal function, and in severe cases, dialysis. Opioid overdose responds to naloxone, a competitive antagonist that rapidly restores respiratory drive, though repeat dosing may be needed with long-acting opioids. Lithium toxicity may require gastric decontamination if recent, plus aggressive IV fluids. In moderate to severe cases, hemodialysis clears lithium efficiently. Digoxin poisoning is countered with digoxin-specific antibody fragments that bind circulating drug, neutralizing its effect and allowing renal elimination. Across all these scenarios, decontamination measures, activated charcoal, supportive monitoring, ECG, renal panels, liver enzymes, and critical care interventions form the backbone of toxicological management. By understanding both the molecular underpinnings and the available antidotes, clinicians can turn potential poison into safely managed therapy